Welcome to the Mendoza Podcast, financial talk that makes sense. I'm your Illinois State Comptroller, Susana Mendoza, and I want to help answer all the questions you have about money matters, but we're maybe afraid to ask. We're going to learn a lot and have some fun together. Hi there, and welcome back, everyone. I've been looking forward to today's episode because it's something a lot of people don't think about until, frankly, it becomes a necessity, and that's paying for fertility treatments. My guest today is Dr. Jennifer Hirshfeld-Cytron from the Infertility Centers of Illinois. Dr. Hirshfeld-Cytron, can you tell me a little bit about yourself today?
Yes, absolutely. And thank you so much for having me.
Thanks for being here.
I am a board certified OB/GYN, and then also I did a fellowship in reproductive endocrinology and fertility, which allows me to practice in fertility medicine. I'm a physician at Fertility Centers of Illinois. I'm also our IVF medical director.
Wow. And so what made you want to get into this line of work?
I always knew that I wanted to do something focused on women's health. I knew that from the very beginning. And then in residency, you get exposed to so many fields. Infertility is unique in the fact that we help couples. We help a huge range of people. We help individual, solo parents, LGBTQ. And I just love that technology improves all the time. And to be a part of that was just a dream.
It's like you're always on the cutting edge, right?
Yeah, we're always on the cutting edge. We're always offering more and more to a wider range of people.
So if a couple is having trouble getting pregnant, at what point are they supposed to come to you?
So it depends. In a traditional heterosexual couple, it depends on the age of the woman. So if she's 35 and older, we give it 6 months before she should be seen. She's less than 35, it's about a year.
Wow. So at 35, so talk a little bit about that precipice, right? Of like, why is it that at 35, if they haven't gotten pregnant, you want to start moving fast and going to see someone like you?
Yeah, exactly. And so what's kind of amazing is through the years, our field has looked at multiple populations of various ethnicities. And like the bell curve back when we were in school, we define normal from abnormal. And as we get older, because egg quality decreases, the expectations is 6 months, somewhere 85 to 90% of couples have conceived. And you fall outside that bell curve. And we want people to see us in the appropriate amount of time so we can expedite them to success.
So this issue that we always grew up hearing that your clock is ticking when you're a woman, which by the way is so unfair, right? Because it never stops ticking for the guy. But for us, you're like, oh, your clock is ticking. When are you going to get married? And it's super annoying, but unfortunately, it is true. And I will speak from personal experience. It's one of these issues, I think, fertility treatments that people just don't talk about. And we should always be talking about it, frankly, and we should be unabashedly talking about it and not be embarrassed to talk about it. It's one of those things that not only getting pregnant, but then once you're pregnant and have a baby, like everyone talks about how beautiful it is to be a mom. When there's like a lot of not beautiful parts of being a mom in the beginning, like your boobs hurt, your breast can get clogged. We're talking about a lot of potentially uncomfortable things today, but this is real talk, right? And so from my perspective, we as women need to talk to each other about the realities of what motherhood is, but also getting there. And so when our mothers or grandmothers tell us to hurry up because the clock is ticking, let's not get mad at them. Let's realize that it's important to educate ourselves about what that means because it is true. I didn't get pregnant until 39. As a matter of fact, I gave birth at 40. And I had not met my Mr. Right for the rest of my life until I was 38. Actually, we went to high school together and we never dated. He was, the quarterback of the football team and I was the captain of the soccer team. And we were just really, really good friends. And then we didn't see each other for another 10 years until our high school reunion. And then after that, another 9 years. So never dated this whole entire time. But then I was like 38 or so when we reconnected, started dating. I'm not thinking that my clock is ticking. I feel super healthy and great.
Sure.
But then when we got married, right before we got married and we met with our priest, he asked us, do you guys want to have kids? And I said, of course we want to have kids. And David's like, of course we want to have kids. Because can you have kids? And doctor, honestly, nobody had ever asked us that question before, nor did we think that there would be any impediment to having kids. And we said, yeah, but why would we not be able to have kids? And he said, well, this is one of the biggest issues that affects couples who are so happily in love and want to get married that they think they can get through anything. But when they find out that they might not be able to have kids, could end a marriage very quickly, right? And so you should know going into the marriage whether or not this is a deal breaker for you, and you should go see a doctor. So he sent my husband to go see a doctor to see how his, his sperm, right? His boys, or what do you want to call them, were working, his swimmers. And I had to go see my OBGYN, and we literally called them the very next day. And I asked Abby, who's a dear friend, I said, is there should I be worried about this? And she goes, absolutely. And I'm like, well, why didn't you tell me this before? She goes, well, because you weren't really dating anybody seriously and you never said you wanted to be a mom.
Sure.
And so I just gave you my whole important pregnancy story, but it's like everybody's story, right? Like so many people have issues and they don't know they have issues until they realize they have them. And that's why people like you're not just a doctor. I'm going to thank you on behalf of all the women and the men who you helped to become fathers and mothers, and all the little kids that are running around right now, Chicago or elsewhere, because you made their lives happy, and the thing too about infertility and then the treatments for them, which you are a champion of here, is that these are all folks who are ready and wanting to be parents, right? We're not talking about the sex ed classes that my kids get in school today, the awkward talk, as he calls it, which is all about preventing pregnancies. That's what we grew up learning about.
Sure.
But today, you're going to talk to us about the other talk, getting pregnant. So keep going.
So, well, thank you for sharing that story. I think your priest was it's an extraordinary priest, I'll be honest with you, to be so proactive and ask those questions from the very beginning. The challenge with infertility, exactly like you said, for women, is that we haven't outsmarted the body. So in every way, we live long, healthy lives. 50 is the new 40, and 40 is 30. Yeah. But our ovaries haven't caught up to that logic.
Right.
And they are absolutely fixed by your age. And we lose peak egg health initially in our late 20s, and then more dramatically in our 30s. I think there's this perception that, well, that's okay, I'll do IVF. But IVF can't overcome the age factor.
That's exactly right.
And so that's the challenge that we have, is that our field actually kind of has a rate limiting piece, which is the age of the egg. And then through the years, we always were able to freeze eggs and embryos, but the capacity to freeze eggs reliably skyrocketed maybe about a little over 10 years ago. And now we have this technology that if we live our lives, we can't say take this and your ovaries will be forever 29. But if you're 29 and we freeze your eggs, they actually are forever 29.
Yes.
They will be the health of a 29-year-old, even if you're 55.
So say that again, because I think that's what a lot of people don't understand.
Yes. So when we freeze your eggs, let's say at a young age, let's say 29, when you come to use those eggs, the age you are to use them doesn't really matter. It was the age that you froze them.
So if I'm, 50, but I froze my eggs at 29, I'm going to have the quality of my eggs is pristine essentially at 29.
Exactly.
And so I have a really high probability of that egg being properly fertilized and becoming a baby.
Absolutely. The ability to be successful is really as if you're still 29. As we get older, for all of us, the risks of being pregnant, of course, are things we have to think about. It's important to be at healthy weight because we think about high blood pressure and diabetes. Be the healthiest form of yourself helps you in caring. It doesn't help you in the getting pregnant. But when you have that younger age, it's like a gift to yourself.
For sure.
Yeah, I saw someone today. She's 48. And she's like, I gave myself that gift. And you absolutely did. You should thank.
She's a rock star.
You're 20, yourself 13, 15 years ago. Yeah.
Yeah. And when we were very blessed to be able to have a very healthy, awesome little boy. He's, 12 years old now. And we, because our doctor was a dear friend, Abby, and our priest was very, very smart and had the talk that probably most priests don't have with their folks when they're doing their pre-K. She said to me, I want you to see my friend, and you may know him. I don't know. He's no longer with us, unfortunately. But at the time, Dr. Edmund Confino out of Northwestern Memorial. And so she said, I'm going to call my friend and see if we can get you in to see him. And I'm like, why would I need to see a fertility specialist? I'm only 38. She goes, girl, the chances of your eggs fertilizing or you having a healthy one at this point are almost non-existent. And it was not the conversation I thought I was going to have, but she's like, it's just reality. So you're going to need help. And I would say, normally we would tell you to wait 6 months, which is kind of how we started, right? But if we do, then you're 6 months older and your eggs are 6 months older. At this point, every day counts. So let me make the connection with Dr. Confino. When you guys get back from your honeymoon, go see him. And so I get a call from Dr. Confino. He didn't even wait for me to go on my honeymoon. And he's like, I want to see you and your fiance tomorrow in my office. So we went and we thought he was going to talk to us about vitamins or, things to do
Yes.
when preparing or wanting to get pregnant. He's like, we need to start treatments now. And I'm like, no, I'm Catholic. He's Catholic. Our parents, no way. We have to wait until we're married. But it was literally going to be in a couple weeks. So as soon as we got back from our honeymoon, he says, we're going to get to work. And I thought, what? We're not waiting the 6 months. He said, no. And we got married in December. And we got pregnant through IVI actually in March. So it was very fast. And we thought, wow, this was easy. But then when we tried to do it again, we lost 4, right? So we got pregnant 4 times, but we just weren't able to keep them. Why? Not because the quality of the care wasn't great. It's just that your eggs are old. So again, freeze your eggs. When people ask me what's the best advice you can give a young woman, I say freeze your eggs if you want to be a mom. And even if you're not sure if you want to be a mom, because people's opinions change over time, you only have this window of time in which your eggs are at their optimal point. And so I told my husband, if we have a little girl, because we didn't want to know, but I did say, if we have a little girl, I'm not just going to start a savings account for her future, but I'm going to start a savings account for her to freeze her eggs so that will know that we have the best shot of being grandparents someday.
Yeah.
And she doesn't have to worry about finding Mr. Right now, but finding Mr. Right.
Yeah.
Or whoever it is, right?
Yes, I've told my kids the same. At 28, I have 2 girls. Like, regardless of where you are in your life, you'll be.
Have they frozen their eggs yet?
They're 16 and 13.
Oh, okay.
They know it's on the horizon.
When they're in their 20s.
That's
Excellent.
something to look forward to.
So on that point, though, what's covered by insurance and what's not when it comes to freezing eggs or fertility treatments in general?
And so I think absolutely we should talk about it more. We should talk about it more in our state. Like, we should be very proud of the legislation that has come forth.
For sure.
We have one of the best mandates in the country. And I know the goal is to create a federal mandate so that it doesn't matter where you live in terms of your coverage. We're not there for all the reasons. But in Illinois, and I'm speaking to the choir, but if you work in Illinois and your company has X number of employees, you're required to provide fertility coverage. And it's varied, right? For some, that is, traditionally it's 4 IVF cycles, but some insurances, it's a set number of dollars. Infertility is still viewed differently than egg freezing. Egg freezing, from the perspective of the vast majority of insurances, is viewed as elective. And so,
which means they don't cover it.
Which means they don't cover it, unless there's a couple of carve-outs. If you have a cancer diagnosis, they cover it. There's maybe 2 or 3 insurances now that actually cover it. In my experience, there seems to be those in the tech industry. Pages of mine, and like who look at Pinterest, etc., do have this covered. So I think it's a way that companies are attracting women.
Yeah, certainly. It makes sense for young women. If you want to bring in young talent and you don't, I hate to pose it this way, but cynically, right? Some people might not want their top administrator to get pregnant right now. So the incentive is go ahead and freeze your eggs when they're at their best. Give us a few good years and we'll cover that treatment for you, and then go have a family when the time is better, right?
So there's a clear incentive from the company. The same idea that they say
100%.
You can do your laundry, like they want you to never leave. But comprehensive reproductive care, I think, includes egg freezing. It includes how we support women once they've delivered. It includes maternity leave. It includes the whole gamut. It includes supporting people taking time off from work.
Sure.
Like, the perspective of how we view that probably needs to change. But egg freezing needs to be a part of that conversation.
100%. And it actually saves so much money in the long run because you have to do so many more treatments hoping that you could get pregnant when your eggs aren't of high quality, which costs a lot of money and is covered, versus get them at their best point, freeze them. It's a nominal expense compared to what it actually costs to go through IVF. So talk to us about the math, right? Because the math is important.
Yes.
Freezing versus you didn't freeze, and now you have to go through multiple IVF or IVI treatments.
Yeah. So and there's been like studies that looked at cost effectiveness, and they've decided that, yes, exactly what you're saying, that total egg freezing is going to be more cost effective because it minimizes the number of treatment you need. So if you don't have coverage for egg freezing, probably including the medications that can be very expensive, it can be as high as about $15,000. When it comes to doing IVF, the thing that has now changed is insurance, particularly here, views you differently. So most of my patients have infertility. So most of it's a question of copay, co-insurance. It's not a question of covering completely. And those who don't have coverage, IVF with testing of things like embryos can be, $20 to $25,000.
So much more, and that's per
Much more.
treatment.
This is per cycle,
Yeah.
absolutely. So I think um, you've done a great job here about how we address fertility. I mean, of course, there are still people who find themselves outside who fit that definition who are underinsured. But here, when you have infertility, we're pretty lucky. The egg freezing piece, I mean, it's going to take, I think, a lot of effort to make it more universally covered, but that would be
Yeah.
the ideal.
Yeah. Well, it makes sense. I mean, math is math. And I always say when you can save money and actually provide a better service,
Yes.
it's a win for
Yeah,
everyone.
it's a win for the companies that still direct how their healthcare dollars are spent.
And frankly, our birth rate is not where we would really want it to be continue to be like at the forefront of being competitive on a
Yes.
global scale. And
Of course.
something we don't really talk about much, but we probably need to start doing. And the way to address that is also through smart, comprehensive legislation.
Yeah.
Now, are there financing options or anything like that available for people who don't have insurance, but like any kind of niche industry that caters to that group?
So there definitely are financing options. There definitely are companies that provide loans. And so there are ways that you could sort of be able to pursue treatments if you don't have that very high number available up front.
Mm-hmm.
I'm also a part of actually a nonprofit called the Chicago Coalition for Family Building. So it's like my off hours gig. I'm the vice president of that entity. And we do provide grants actually for those who find themselves underinsured.
Well, that's awesome.
It is. And I love the work we do. We're small. So we get
Mhm.
grants probably about once to twice a year.
Okay.
And some patients find their ways through that. There's a couple of nonprofits, but the vast majority, it is either loans. Sometimes I've had patients who have had from family members, or they themselves have saved.
Oh, okay. Well, that's interesting. It's hard though. How would you go about like? Have you ever had this conversation with someone who can't afford it? They're still within a window of time, and where their eggs are still of high quality, perhaps. And or do you only really treat people who were like the me's of the world or worse off that have been trying and trying and trying and just can't get pregnant? Because it is something that we need to talk about people saving for and how you go about.
Yeah.
How long does it take for you to have the type of money that would allow you to have this certain benefit?
So, I mean, we treat the whole gamut. Like I see quite a few women who freeze eggs. I mean, it's like skyrocketed now.
Yeah, the technology's so great.
And especially more and more people are getting it covered. Like I think I agree on like the legislation piece, but like as a society, we have to value this.
Yes,
There's no reason why employers shouldn't cover it.
100%. But don't you think it's interesting now with the politics of this? This has become a political thing. I think it's so ironic to me that the folks who were insisting that women have babies, whether they're prepared to have them or not, are in many cases the same people who are telling you if you want to have a baby, you can't have a baby because these treatments are wrong or whatever it may be. And again, going back to how I started, people who seek these treatments are exactly the kind of people that you would want to be having babies because they really want them, they're prepared for them, they most likely have the financial means to be able to care for them for the long haul. So I think that the politics is like very misplaced because not only is it wrong to stop a family who really wants to create a family from having one, but it also doesn't help, our country
Sure.
be competitive on the global stage when our birth rate continues to decline.
Yeah. So to your point, so if we start with like the end in mind and we want to increase our birth rate, we have to change how we view this. Um, when it comes to egg freezing, I would say the cost piece is one. They're the time intensity for some patients. I think it's important for individuals to also realize like peak time is like 28 to 32. Every time a resident rotates with us in OBGYN to see what we do, a lot of them then become patients.
Oh yeah, I bet.
The knowledge
Yeah.
and the awareness of like the time is of the essence.
Yes.
Uh, how to save for it? I mean, it has to be something that we think about much younger. So to your point, your OB had said to you, I wasn't sure you were interested, but I think these conversations are changing. I have so many patients in their 20s, their OBs are like, if this is something that's a priority to you, you have to plan for it.
Yeah.
So I think we need to get employers to cover it, educate people sooner. Politically, the irony is that egg freezing is something that, regardless of where you find yourself on the political extreme or the religious extreme, these are not fertilized eggs. So
Mhm.
everyone should be in favor. So the
Totally.
use of the
Yeah.
discard of eggs has never really been a point of contention.
Yes.
And so if we freeze eggs versus freezing embryos, those who oppose it should be more in favor.
For sure.
Religiously and politically, we should be more in favor of this.
That's right. The freezing of the eggs. It's just your eggs. You're just taking them out here when they're at their perfect moment.
Yes, we lose them every month.
They're not fertilized. You kick them out anyway naturally. You're right.
So it's a win-win. I think it's just how we go about making those changes. But I think it starts with things like this, that we just educate people.
Talking about it, talking about it.
Keep people aware.
Do you not agree that, and you don't have to, but I feel like just having these conversations with my girlfriends, there is so much more difficulty getting pregnant when you want to get pregnant than what we've been made to believe, right? So we're raised to think like, oh my gosh, if you look at that person, they're going to get you pregnant, right? So don't look. And the reality of it is that it's right to tell kids, don't go there when you're not ready. But it's almost like so ingrained in our minds, right? To like this whole concept of preventing pregnancies that you don't realize and you're not educated about this critical window that if you do want to have kids, but you don't want to have them right now, here are your options to still safeguard your ability to become a parent later when you're ready and you want to do it. And I feel that we don't talk about it. Like if you're having fertility issues, it's not something you want to share with people. You may share it with your closest friends and you may not. Now, I shared it and I do share it. And I think the fact that I was able to share it helped me get through the fact that, we lost 4 pregnancies after having our son and we're okay with it. It was super sad, of course it is, but I felt like we were so thankful that we had one, and it thankfully was easy to get him. It was on our second try, and he came quickly. And we thought, wow, that was like a lot easier than I had heard. But then my thyroid got out of whack immediately after having him. And it was probably also given my age, right? So like just things happen to your body. And even though I was in good shape and all those things, had a beautiful pregnancy. But then after he came, my thyroid got out of whack. And so that then complicated my ability to get pregnant within like the next year and a half, 2 years. We couldn't even try because they had to get my thyroid under control. Otherwise you lose the baby for sure. And so we started again like at 43 or 42 and forget it, your eggs are toast by then. And the technology had not yet caught up to where it is right now.
Sure.
But even if it had, I would have been freezing like 40-year-old eggs versus 25-year-old eggs or 28-year-old eggs. And so I talk about this with everyone. When I have groups of young girls that come see me in Springfield that are in high school and they ask me, what's the best advice you can give me? And I always maybe make people uncomfortable, but the girls are always, oh my gosh, thank you, because no one's ever said that to us. I tell them that the most important decision they'll ever make is who they decide to spend the rest of their life with, right? Who your partner is, because it makes a big difference no matter how great your job is. And everyone thinks it's like your job, right? But it's your job no matter how great it is. If you come home and you don't want to come home every day to that person, it's not going to be great. And you don't have to have that person, right? It can just be yourself, but you have to be happy with yourself. And if you do have a partner, pick the right partner. And then number 2, freeze your eggs. If you know that there's even the slightest possibility that you might want to be a mom someday, freeze your eggs so you can find Mr. Right instead of settling for a Mr. Right now, and it might not work out, right? And so those are conversations no one had with me. I wish I would have had them, but even if they had, the technology hadn't caught up yet, but it is there now. So look at it as almost an insurance policy, right? In terms of, I don't know for sure, but it's the best $10,000 or $15,000 that I'll ever spend. And as an adult, if I had a little girl, I wouldn't even put that on my kid now. I would put it as my insurance policy to be a grandma someday and have it there so that my daughter doesn't have to worry about it. We'll pay for it, but we hope you do it. And I think if you educate your kids about, this importance and the struggle, then they're just going to get it. This is an issue of education or lack thereof on how important of a topic this is that people don't talk about, but we need to untaboo it.
Yeah, exactly. I mean, it shouldn't be something people experience in private, like we experience infertility or loss.
Yeah.
We're getting better, but we still have a ways to go.
Yeah.
It's sort of odd to say this, but whenever you think of like the Kardashians, they definitely brought this issue to light. They openly talked about their own fertility journeys, egg freezing journeys.
Yeah.
That's critical. I mean, they reach an audience that nobody else really can.
Totally. Much more than this podcast.
Yeah, well, much more than anything I'll ever do. Like Khloe Kardashian posted something about when she froze her eggs, and I can't tell you how many patients I saw as a result of it.
That's awesome.
So yes, and so more and more people in the limelight, like celebrities, bringing this issue to heart is critical.
For sure.
That's a piece of it. So education, talking about it with our doctors, talking with each other. thanking those celebrities who personally experienced it to share it, because that has a huge impact on people's perspective. I think when I think about how I talk to OBGYN residents, when I was a resident, which was a fair amount of years ago, it actually was even taboo to be pregnant. You always look down upon someone. And 4
Really?
weeks of maternity leave. And medicine is better, but it was brutal about how he supported
Sure.
women to be pregnant. So there's this idea, well, I have to put it off. I don't have a choice. It's either my
Mhm.
or my capacity to be genetically connected to my child. We all knew it. It wasn't like we had the people who had the
Yeah.
best information about what happened to ovaries. And so I think it's also for those who the cost isn't the piece to say, take the time. Like if you're feeling
Exactly.
pressure, whatever you do professionally, take these couple of weeks. Because I'll have people say, I just can't figure out how to do that. I'm a consultant. I travel all the time. It's like, we have to put ourselves first at some point. And
Yeah,
it has to be when, you know, when it has to be when things are right.
that's right.
Like it's never a good time, but it's always a good
100%. My doc, it breaks my heart that she didn't have her own baby, and it's because she was busy bringing everybody else's babies into the world. And now, thankfully, she's an adoptive mom.
yes.
But which is, wonderful and
Yeah,
amazing.
all the things.
But you think about this, what you just said, I'm sure happens across the board.
Yes.
And that's something that needs to change within the medical industry because it's not okay for women to have to like sacrifice everything.
Yeah.
Um,
It's been featured more and more in fertility rates in physicians is higher than the general population. But whatever rigorous job you pursue, there's always time.
for
We
sure.
have to put ourselves first at some
Well, I was city clerk of Chicago when I had my son, and I was the first woman ever elected city clerk of Chicago. And I gave birth to my son during my first term. That's when I got pregnant. And I brought him onto the city council chamber floor as a little baby. And it was awesome, and you have to do that. Like women have to show that we can do it all.
Yeah.
We can do it all.
Yeah.
And if a guy had to go through the labor pains that we did, I think he'd have a lot less babies in the world than what we have. But
Yes.
right? For sure.
Yeah,
You
and
know it.
it's definitely better. It's definitely better in medicine. And I was a resident decades ago. And I delivered my first couple of months of fellowship. Dr. Capito was my mentor. I was at
Oh, wasn't he the best?
He was
The best.
he was
The
absolutely
best. I love him so much.
yes.
Yes.
I love him so much. He's a huge so with a huge
So to Dr.
loss to our
Confino,
world. Yes,
thank
oh,
you.
Dr.
Yes.
Confino. But when I started fellowship, people had it wasn't as taboo. They were like, oh, well, so they want to share with us. Yeah, actually, I'm delivering in 2 months. So
That's awesome.
FYI, but yeah, you make it work.
You make it work. You know what? I had my first meeting with Dr. Confino, and I was, 39, I guess. It would have been, yeah. And he looks me in the eye and he goes, "You're going to be a mom. It's going to happen." And I just believed it. But at the time I got so scared when he showed me the charts on our first date, as I call it, right, with our fertility specialist. He showed me the charts of how improbable it was for a woman to get pregnant naturally after the age of 35. It's like your miscarriage is like, and then it goes, phew. And that was really eye opening, right? But again, those are things nobody teaches you, nobody talks about. Women who are going through fertility issues don't like to share with others. So everyone thinks it's super easy to get pregnant until you choose that you want to get pregnant. And then you realize it's not. And this issue of infertility is an issue that so many people that you least even imagine are dealing with or have dealt with. And that's why, again, it's really important to talk about. And I'm so glad that you joined us today.
Yes, well, I'm so glad to have been here.
Yay! Well, thank you. And one last thing. I mentioned IVI and we talked about IVF, but what's the difference between the two so the audience knows?
Yes, of course. So when we think about freezing eggs, this is freeze your eggs in the future. Eggs that were frozen, we have to use in vitro fertilization, which means outside the body in the dish for egg and sperm to meet. So once you've frozen your egg, that's the trajectory of how you have your child. IUI is that we give medicines and then we choose an optimal day based on how someone responds to place sperm into the cavity. So technically, egg and sperm fertilize still in your tube
Mm-hmm.
versus outside the body, still fertilize within the body. So that becomes sort of the two differences. IUI logistically, it's easier for someone to do. IVF is more involved with medicines and procedure under anesthesia. It tends to have higher success rates.
Mm-hmm.
And I would just say to your point about more and more people, infertility affects like the 1 in 6 for heterosexual couples, but single women, single men, same-sex men, same-sex men, there's a broad group of people that we get help.
A ton of people.
A ton of people. So regardless of how someone envisions sort of having a family,
Mhm.
regardless of it sort of if someone is a member of the LGBTQ
Sure.
or not. Freezing our eggs impacts everyone. So even if your thought is, well, I'll just use a sperm donor in the future, we just still want to make sure the eggs are of quality.
The
for that to
egg
work.
is the
The egg
issue.
is the key.
Yes.
The egg is the key.
So people always ask, well, why didn't you have more kids, right? You get that too, which actually stinks because people just assume, and it just, you can't get mad at people because they don't realize that it's not that you don't want to, it's that you couldn't, right? So I always get, so why didn't you have more kids? I mean, you're such a good mom with David. And I'm like, well, I would have loved to have more kids, but I had 4 miscarriages after. So but it's also like, I think important to tell people. And they're like, oh my gosh, I feel so bad. I'm like, no, don't feel bad. It's okay. But it's because my eggs were super old after 35, what do they call them? Geriatric, right? Or advanced maternal age. Yeah.
But just like you said, it's changing.
And you don't think you're old at 36.
Of course. And it's changing the perspective, right? So that as a society, nobody would even think to say that because we all know it's actually hard to get pregnant.
Exactly. Yeah, but it's okay. And it's, I always used to think to myself, and true story, because I had friends that at the same time were trying to get pregnant. And we already had our son. And we were trying to get pregnant again with number two. And I remember praying, like, if it's got to be one of us, let it be her, because I already have one. And I know what it's like to be a mom, and it's like the best. I love it. But you think, like, as much as I want to have that number two, like, you want that for your friends who are really, really trying and who, emotionally are having difficulty with that. I get emotional thinking about it, that, they didn't get pregnant. And I'm like, man, that really stinks, because again, if we had known, it's all about those eggs. It's not about, that we're too old or not in the best shape of our lives. It's just that the eggs, no matter how great we feel, no matter how lean and mean our muscles look, you could be, if you're 40, those are like 80-year-old eggs, is what it seems like. Yeah, exactly.
Proactively plan everything down. You pick your gym, your exercise schedule for the next month, like everything. This should be part of it. We need to change that perspective. What am I doing in my career, professional? And if it's a priority me to be genetically connected, what am I doing to make that a reality?
Yeah, and then the last thing I'll say before we wrap up is, try to be the healthiest version of yourself possible, right? So it's not just about freezing your eggs when they're at their best, but freeze them, number one. So that's number one bit of advice. But I would say also, then take care of yourself, take care of your body, take care of your mind, be in the best possible place that you can be both physically and mentally before taking that next step, because it is tough. It's tough enough to get pregnant, and then it's tough to go through the pregnancy. And then you never know what's going to happen after the pregnancy. And like I said, your boobs might get seriously clogged when you're trying to breastfeed, and it hurts like hell, but it's also like the best experience in the world. So, my last bit of advice is talk to your girlfriends who've been through it and ask them, because I think everyone will open up as to what the realities are of trying to get pregnant, of being pregnant, of having the baby, and then, of course, the trials and tribulations of being a parent. But anything else you'd like to add, Doc?
Just like what you said, get rid of the taboo, talk to your friends, talk to your physician, and I think just ask the question so you choose all the options that are right for you.
For sure. Well, thanks so much for being on our show, our little podcast. Love having you. Thank you.